Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine, and today we will discuss about forensic odontology. Forensic odontology, by definition, it deals with the application of dentistry knowledge to aid in the administration of justice. So, dentistry knowledge is used for administration of justice. It includes identification of unknown bodies through dental records, identification of bite marks, and age estimation of skeletal remains. Identifying of human remains. Unidentified bodies are seen in cases of violent crimes, disasters, accidents, man-made disasters like mass casualties occurring in the aviation industries like airplane accidents, drowning cases, burns, murders, suicides, death from natural causes. These all rely on dental evidence for identification of body. In this, dental identification is that postmortem dental remains can be compared with dental records, including written notes, study casts, radiographs. So, if the person who is dead has some previous dental records, can be useful for identification by comparing the dental records. Individuals with numerous and complex dental treatments are often easier to identify than those with little or no restorative treatment. A range of conclusions can be reached when reporting dental identifications. Even with only few teeth are available, one can even get something like age estimation can be determined. Based on which teeth are adapted, age can be determined. Smoking habits, state of oral hygiene, these features can be identified using can be identified easily identified from antemortem records. Now coming to identification from bite marks. Bite marks are commonly seen in case of sexual assaults. It can be seen on the breast, neck regions, shoulders, thighs, abdomen, on pubis or vulva. In case of child abuse, it can also be seen cases in anywhere on the body, such as on arms, hands, shoulders, cheeks, buttocks, and tongues. Bite marks in scene of crime can be seen on foodstuffs like apples, cheese, chocolates. Can be seen on leather ornaments, leather garments, on keyrings, belts, and woods like pencils. Bite marks can be seen. Police officer can be also be bitten by during resisting means when they're catching the criminals, they may bite the police officers. In sporting events like football, rugby, or wrestling, bite marks can be seen. In assaults, where marks may be found anywhere in the body. Bite marks usually comprise of crop of punctuate hemorrhages and varying from small petechiae to large ecchymosis. So usually bite marks causes bruises and they consist of multiple the multiple bruises ranging from petechial hemorrhages to large ecchymosis. Human bites are usually causes semicircular in nature or crescentic caused by front teeth. Mainly the incisors and canines are prominent in that with gap on either side due to separation of upper and lower jaws. Whereas deep parabolic. So humans have semicircular like this is seen in this image, but deep U-shaped skin characteristics of animal. So animal bite marks usually have characteristic parabolic shape, but semicircular is seen in humans. So humans bite marks are semicircular with upper and lower teeth marks, and in between gap will be present. They may also include this may leave abrasions, bruises, and lacerations based on how much force the bite marks is used. Self-inflicted bite marks can be seen anywhere on the body, usually in the accessible part, mainly in the arms, are also seen in certain cases. Usually seen in case of psychiatric patients are teenage girls. Accidental marks resulting from falls on the face during fits or biting of the tongue and lips may also be present. In sexual assault cases, sucking action during bites reduces the air pressure in the central area and produces petechial hemorrhages. So, as I told you, the bite marks which are semicircular, in the region between the two bite marks, because of suction, sometimes petechial hemorrhages may be seen. So petechial hemorrhages are nothing but pinpoint hemorrhages which can be seen because of rupture of capillaries. Identification of bite marks is possible if incisors can have some characteristic features. Bite mark investigation can be done by photographs where bite mark photograph is taken from different angles by swabbing the saliva in case of secretors. So secretors are a group of individuals who secretes or they have the blood groups can is secreted even in the body fluids. So secretors body fluids like saliva consist blood groups can be identified from saliva also. In sweat also they have blood groups. So in secretor groups, swabbing of saliva can be useful to identify the blood groups. Impression of bite marks can be taken from using some plastic substances, or plaster of Paris can be used to take the cast of the bite mark. In case of person dead bodies, skin carrying the bite is removed and preserved in formalin during autopsy. Now coming to dental profiling. So dental profiling means the making a recording of a dental profile of the persons. So when dental records are unavailable and other methods of identification are not possible, the forensic dentist often produce picture of general features of individuals known as dental profiling. So using dental profiling, they make the characteristics of all the characteristics of teeth are recorded, and that profile of that person is made. It would typically provide information of the deceased age based on the eruption of teeth, background, sex, socioeconomic status, and his habits also can be obtained. In some instances, it is possible to provide additional information regarding occupation, dietary habits, habitual behavior, occasionally, and dental and systemic diseases. So, occupation can, like certain occupations, occupation marks can be seen from teeth, or dietary habits. If oral hygiene, what he eats can be found in his teeth can be obtained. Microscopic examination of teeth can confirm sex by presence or absence of Y chromatin and DNA analysis of the root of the teeth. Because of resistant nature of dental tissue, dent teeth provides a very valuable specimens. So from teeth, so usually teeth doesn't usually get destroyed. It is remains intact even in insertion, immersion, trauma, mutilation, and decomposition. So they provide excellent source of DNA materials. When conventional dental identification method fails, this biological model can provide a necessary link to prove, identify. Now, charting of teeth. So, charting of teeth are done and to know the makeup profiling of the person. So, in this they include, they mention the whether there is any extraction or recent or old extraction of teeth is present, any fillings, number of position, compositions. So, usually the doctors record the patient's dental record using, they mention any abnormalities. So in that it includes extractions, fillings, presence of artificial teeth, whether of gold, porcelain, or stainless steel, prosthetic work in mouth such as bridge work or any braces are present or not, any crown teeth, broken teeth, any pathological condition in teeth, jaws or gums, congenital defects such as enamel pearls, calabrese skulls, or ectopic teeth is present, malposition teeth. So this is again very characteristics can be useful for identification. General state of hygienes like caries, plaques, tobacco staining, gingivitis, racial pointers such as shovel-shaped upper incisors or multicusp morals. So these are all features are recorded by the doctors in when to maintain the charting to keep the profile of the person. Now coming to charting system of teeth. So this is a form of where the teeth are charted in the form of digits so that teeth can be easily identified. So each quadrant of teeth is divided into four quadrants always. The upper two quadrants and lower two quadrants. So universal system consists of a advocated by American International Society in which each teeth is numbered 1, 2, 3, 4, 5, 6 from right to left and left to right, from upper right to and lower right, left, lower left to lower right. So here each teeth is numbered. So for example, number 8 teeth is the incisor of upper right. 9 is also left, upper left incisors. Then there is two incisors. Then there is canine. Then there is premolar, 1 and 2 premolar. Then 1, 2, 3 molars. So each teeth is numbered. So if 29 number is present, that indicates this teeth is second premolar of lower right. Okay, so instead of writing this, then they made a numbering system. So 29, if just 29 is mentioned in the universal system, that indicates that is a second premolar of lower right region. So this is form of charting system. Similarly, there are one more, the other charting system include power notation where teeth are numbered as 1 to 8. So in each quadrant, the teeth are numbered as 1 to 8, and this usually creates some confusion because you don't know whether it is right or left. Hardware system is also uses same as Palmer notation, but it has mentioned plus sign for upper teeth and minus sign for lower teeth. Then temporary teeth are mentioned as 0, additionally added in address system. Next, in FDI system, it is a 2-digit system. So in FDI system, the 2-digit system, it includes the each quadrant is number has one quadrant, and each teeth is given one extra number. So 1, 2, 3, 4. 1 indicates upper right quadrant, 2 indicates upper left quadrant, upper right, upper left, and lower right and lower left system, lower left quadrant. So in each quadrant, if one is given, 1, 2, 1, 3, the like this number is provided. Sorry, 1, 1, 1, 3, 1, 4. So 1, 4 indicates that the fourth teeth is the first premolar. So 1, 4 means the premolar. Like similarly, 4, 5 indicates lower right, the second premolar. Similar like that. So similarly, registered teeth are given number has 5, 6, 7, 8. So this is a very uniform way of identification of teeth. Modified FDI system similar uses the same as FDI system. Instead of 1, 2, 3, 4, it the quadrant is shifted. Here 1 instead of upper right. So 2 and 3 give is for designators are right side, 1 and 4 for left side on many things. Next system is diametric system where teeth are represented as diagrams. So as and such the teeth are represented. In this each it is represented by pictorial symbols. So pictorial of the teeth are present in which the system is used. So these systems are useful in the sense that if any caries or extraction present, that number can be useful. So for example, in FDI system, if we mention 1, 3, so 1, 3 caries, so that indicates 1, 3 that is canine. Canine has caries like that. So that is how the dental profile is maintained in the doctors. Now coming to medical importance of forensic odontology. So first is identification. So identification is the most sophisticated method of comparative identification in dactylography than characterography, and it is used to, if the records are kept, it can be very useful for identification. Age estimation can be done by individuals based on the eruption of teeth. According to section 320 IPC, fracture or dislocation of teeth amounts to grievous hurt, which is punishable up to 10 years. Cause of death can be known based on the there is because the teeth resist putrefaction. Certain cause of death can be known mainly by poisoning, where the metallic poison get deposited in the teeth. Dentures like partial or complete dentures are useful in identification, which consist patient's name, code number, etc. Criminals can be identified through bite marks left either in the human tissue or wounds. These are my references. Thank you.